Hey guys, it's Sarah here. In this video, we're going to be going over part 5 of the fundamentals of nursing review. And this is specifically going to be talking about all about like skin, hygiene, etc. So first we're going to be starting off by talking about the skin. So some jobs of the skin are to protect you from bacteria, protect you from needles, protect you from just stuff out there. It also regulates your temperature, sensation, so think about if you touch, you feel it, secretions, excretion, so sweating, etc. There are different layers of the skin. You have the epidermis, which is the outermost layer. It protects you, like we just said before. You have the dermis, which has the nerve fibers in it, blood vessels, hair follicles, all this stuff in it. And you have the subcutaneous layer, which is the fat cell layer. Okay, so next we go on to feet, hands, and nails. So with these, you are actually able to see a lot about someone's hygiene. If you look at someone's nails and they're like completely overgrown, yellow, fungal inside, that could tell you a lot about their hygiene and their ability to self-care. And now we go on to the oral cavity. This is lined with mucous membrane. It affects the nutrition if your hygiene is not good. So first of all, it could affect the mouth. You could get sores. It could affect how you're eating, whether your appetite's going to be more or less. And saliva itself could be affected by a few stuff. Number one, medication. And if you think of the anticholinergics, which cause dry mouth, so think about that. Certain medications could affect your saliva. And radiation, if someone's getting radiation for cancer, give them ulcers, etc. Just two terms you should know about the oral cavity is exorasema, which is dry mouth, and gingivitis, which is inflammation of the gum. And next we go on to hair. Hair could also indicate someone's health status. So think about someone who's anorexic and you'll see bald spots or thinning, brittle hair. Also for thyroid, you could look at someone's hair. And hair could be affected by stress, hormones, aging, nutrition, etc. And here are different stuff that could affect hygiene. Number one, someone's culture. It's a cultural thing not to bathe every day or to bathe every day. Preference, personal preference. Some people are very clean people, some people are not. They could care less. Socioeconomic status, if they have the money. If they have the money for shampoo, if they have money for hair stuff or nail trimmer, etc. Number 4 is the body image, how they view themselves. The developmental stage, because what's normal for a 3-year-old might not care about if they're in the urine, but someone older should be. The physical condition, are they able to care for themselves? Are they bedbound? Could they not move? And pain. Because think about it, if you're in a lot of pain, you don't care how you look. So you have to take all these stuff into consideration. So now we go on to the nursing process related to hygiene. So number one, like always, we start off with assessment. Assessment, you want to assess the self-care ability. Are they able to take care of themselves? Do they need an aid? You want to do a full head-to-toe assessment. So like we just went through before, like start from the head, look at the hair, etc., and keep going down. You want to take in note if it's a cultural thing, because then it's not abnormal for them, and take into consideration who's at risk. So even if right now they could take care of themselves, are they at risk for not being able to? And number 2, we go into the diagnosis. Here are some examples of diagnosis related to hygiene. Impaired physical mobility, self-care deficit dressing, risk for infection, activity intolerance, and ineffective health maintenance. And next we go on to planning. So we plan the goals, the outcomes. Of course, they have to be individualized. Everyone has different goals, and you could only expect different stuff from different people. Next we go on to implementation. So that's the act of actually doing the hygiene. So hygiene could be delegated. It could be given to an LPN. It could be given to a tech. You want to help the patient with hygiene, but you also want them to be independent. So for example, you could tell them about community resources, that they could go out to themselves and that they could still be living alone. And you want to do like a demonstration. So say like you show them, and then they demonstrate back what you just taught them, so that when you're not there, they could do it on their own. And last but not least is evaluation. Were the goals met? Here are just some safety concerns related to hygiene. Number one, you always want to clean from the cleanest to the dirtiest. So if you're going to clean for urine, right, and you're cleaning them, then if you're going to clean from the dirty to the clean, it's just going to bring the dirty part into the clean part. So you always want to clean from the cleanest and then outwards to the dirtiest. You always want to use gloves because you're dealing with secretions, etc. You always want to test the water temperature because that's a big safety concern, especially if they can't feel it themselves, like diabetes, like decreased sensation. You want to have proper delegation directions because most probably, a lot of times this is done by a tech. And of course, safe patient handling. And what I mean by that is that if you are going to lift patients or turn them, etc., you want to make sure that you're doing the body mechanics and you're not going to hurt yourself later on in life. And that's pretty much it. That's a short clip on hygiene. Thank you for watching. Please like and subscribe and stay tuned.